Hi everyone, my name is Alyssa and I am 25 years old. When I was 21, I was diagnosed with gastroreflux-esophageal disease, GERD. I think I said that backwards. Gastroesophageal reflux disease. Excuse my appearance. I am now day 5 in post-recovery, and I wanted to share my experience with all of you. I know that I personally did a lot of research before I sought out a surgeon and asked for this procedure. I really was certain that this was what was going to fix my issue. I kind of fell along all the lines that made me a great candidate. To give you some background, I initially started tasting sour acid in my mouth for about 6 months before I went and saw a doctor. And that was around my 21st birthday when I finally did see a doctor. I was consuming alcohol before the age of 21. I know, horrible. But nothing that was extreme and nothing that would have caused more acid reflux than the average individual. I have plenty of friends over the age of 21 who were consuming red wine or alcohol and never experienced acid reflux whatsoever. So when I would kind of talk about it with my friends, they'd be like, I don't know what you're talking about. After I was diagnosed, I had a upper endoscopy done about a year and a half in. The result of that was I was cancer-free. They did see sores and ulcers and scarring and just that my esophagus was eroding essentially from the acid. I had been on omeprazole, pantoprazole, ranitidine. I had been on several medications, Nexium, and none of those were working for me, and I really wasn't getting any relief. And I was really upset with it. I had seen a dietitian. I had worked on my diet, what to cut out. I had gone ahead and lost 40 pounds. And then I gained 20 pounds back. And then I lost another 30 pounds. And then March of 2018, I had another upper endoscopy with a second gastro specialist. And they basically told me that, hey, there's not much more we can do for you other than treat you with medication. Find a medication that will work for your regimen and make sure that you are comfortable, and that's about all that we can do for you. There's nothing else. And I didn't really like that answer. I didn't like the thought of being on PPIs for 20 years and calling it good and spending thousands of dollars every other year to have an upper endoscopy to check out the status of my esophagus, and knowing that I just didn't feel good on a day-to-day basis. I was constantly congested. My stomach hurt all the time. I didn't have a normal digestion at all. I had to see a weight loss specialist in order to lose weight. I tried eating clean and I went to the gym and I worked out, and none of those worked for me, and so I really wanted to show doctors that I was serious about this. And one of the things that they told me that I had to lose weight, and I wasn't a heavy weight. I'm currently about 185, 190, if I'm completely honest. And when I started getting acid reflux, I was 160. So I gained a lot of weight, actually, during my time of acid reflux. And that was kind of surprising to me because I really didn't have much of an appetite at all. So I talked to my surgeon after my March upper endoscopy, and I said, hey, I want to have surgery. And he goes, well, I want to treat you with medication. I had been changed from pantoprazole to Dexilant to lansoprazole to omeprazole again to I can't remember the one I'm on now, honestly, or was Acifex or something. So that's about like 5 different medications. I had been changed from March 2018 to the end of December 2018. And today is January 1st, 2019. So I said, all right, I want a recommendation to a surgeon. I had done a lot of research on the TIF, on the links, on the Nissen Fundoplication. I had seen a lot of great recovery stories and how it changed people's lives. And I thought the TIF was the one that was going to be the one for me. Because my second upper endoscopy showed that I had a hiatal hernia. And that I was grade 2 esophagitis. I probably said that wrong. Sorry. And I had told the doctors multiple times that my medications weren't working for me, and just I didn't feel listened to. I didn't feel heard, and that was very frustrating for me to be spending, $2,000, $3,000, $4,000 a year for medical care on acid reflux and getting nowhere and feeling miserable and vomiting acid. Like, that just is not how somebody should live their life at all. That's not great. It's not enjoyable. And I was tired of it. So, beginning of October 2018, my doctor said, fine, here is a recommendation to a local surgeon. I knew the surgical group that I was going to. They are very well renowned in our vicinity of California. I'm in the Central Coast, San Luis Obispo. So I saw Eric Salinger, October 12th, 2018 for a consultation. He reviewed my medical history, and he said, hey, I think that you would be a great candidate for the Nissen Fundoplication. I even asked him about the TIF procedure and the LINX procedure on which one of these would be better. And he said, no, I think you need the full Nissen. And I said, okay, let's do it. So I worked out with my work, and I've been blessed to have great health care. And so it kind of worked out that I could have the surgery on December 28th, and it wouldn't cost me as much as if I had had it in 2019, if that makes sense, just because of all the medical expenses. I had already met my deductible. I was already almost already matching almost my out-of-pocket cost. So for the US, I know people are familiar with that. The UK, I know you guys, or Canada, you guys have a little bit different healthcare, and you guys can kind of just go to a doctor. In the US, it's a little bit more difficult than that, and complex in regards to insurance. So I did a lot of research on Nissen Fundoplication once I got approved, and I said, let's do this. It's going to change my life. I believe that it will. I was really nervous about the diet because it is about 4 to 8 weeks before you can get back into a normal routine again. And I didn't know how that would affect me because I had seen horror stories of people saying that theirs had come undone. I had seen people say that they had nerves that were hit and they've just been in pain and miserable ever since. And it had been a year at that point, and they were still trying to find a fix for it. And so a lot of recovery stories were varied, and it wasn't really cut and dry. I had had an appendix surgery about 10 years ago that was done laparoscopically as well. And my surgeon said that it was going to be very similar in regards to pain, if not, would be actually less pain than an appendicitis surgery. I don't know if that's 100% true. Now that I'm in day 5, it's been a while. They're both definitely painful, if I'm honest. This is not something to go into thinking that, I'm going to get all the pain meds, it's going to be great. No, you are going to be uncomfortable for a while. One thing I didn't see much of was post-op. I went in to the hospital a week before my surgery. They said that I was a healthy weight, I had great blood pressure, I was a healthy 25-year-old, and they didn't need to take any x-rays, I didn't need to do a barium swallow, pH test, none of that. So, ultrasound, nothing. So they were really going in kind of, I don't want to say blind, but they definitely had my upper endoscopy history and everything. So I felt comfortable with that. But I spent an hour being asked a ton of questions. Who's going to help you with aftercare? Are you prepared for this surgery? Are you feeling anxious about? What are your questions? All those things. All that happened in post-op. Day of the surgery, I went in very anxious. I personally suffer from anxiety, seasonal depression. I had depression when I was younger. And I kind of panicked the days leading up to it. I was very emotional. Somebody would ask me a question and I just would burst into tears and I would say, I'm sorry, I'm not trying to cry. I don't know why I'm crying. I just was very emotional about the whole thing. It's life-changing, and not knowing the outcome of what this could lead to, So I went into the hospital 5 a.m. Hadn't had anything to eat or drink since midnight. 5 hours before, I had a burger. It's my last meal because I knew that bread and meat was going to be the last thing I was going to be able to incorporate into my diet. My mom was with me. They start you out. I was considered a outpatient. They did not say that I was going to be staying a day or two for this in the hospital. If I wanted to, I could have. Definitely, if I wanted to. But they really want to get you on the mend and home and recovering, in your own home. So, prior to surgery, I wish I had known this prior, and so I'm glad I can share this with you now. I ordered an abdominal binder. They didn't give me one out of surgery, and I wish I had one of those. And in my future videos talking about my day-to-day recovery, I'll explain why. But basically, more or less, every time I got out of bed, I had to hold my stomach. Like, your abs just were worked on. The things that, excuse me, kind of get hiccups or little burps every once in a while. They're kind of painful, but that's okay. An abdominal binder was suggested to me by a friend who is a nursing student and has actually seen this procedure be done. And I've basically just been carrying a pillow around with me, holding it against my stomach everywhere I go for the first couple days. It's now day 5 when I'm filming this, and it's much better. I don't really need that, but I think it will still come in handy. So I'm at the hospital around 6:30 a.m. They take me down. I speak to the anesthesiologist. He gives me a happy drug, one that makes me feel less anxious. It was great. It was wonderful. And the surgeon came in and he asked me if I had any last questions. One thing I didn't ask him about, but I wish I had, and I actually ended up having to call him 2 days later, was when I was about to shower, if I had stitches or steri strips, because all I had was bandages. And for me, I had steri strips underneath the bandages, and he said I could shower. I just kind of put soap over just warm water. So I would definitely ask your doctor if you are having stitches being put in or steri strips, so that when you get ready to take a shower, you know the type of procedure to go about in regards to if you need to put a new bandage over or something like that. But I felt okay going into it. I picked up my pain medication prior. I was prescribed Norco. I've had Norco before. It was fine for me, but I was a little worried about actually consuming it with my esophagus tightened. So I asked the doctor to change my prescription to a liquid prescription. So I was provided hydrocodone acetaminophen, 3.5 milliliters. That was recommended for me. Do not, this is an opioid. This is not something to go off of my prescription, but that's what I was provided. And And so I picked that up, and that was liquid, and I'm so glad that I did that, because that would have been way better than crushing up pills and putting it in Jello or applesauce. So coming out of surgery, I was very loopy. I remember the nurse looking at me and saying, remember to breathe, because I just kept kind of dozing off and not really taking deep breaths. I did have a tube put down my throat, so I did have a sore throat for about 2 days. And my neck was kind of sore. I don't know if that was from the gas or just because of the tube. But you could definitely feel the gas pain almost immediately after you were in recovery. My surgery was 3 hours long. I don't know if that's standard. For me, it was. They said 180 minutes. Mine was 3 hours long, and he even told my mother that it went a little longer, but that my blood pressure stayed perfect the whole time, and that he thought I was going to be able to go home that day. Couple hours in, I was able to start consuming broth in day stay. I was able to get up to go to the bathroom. I did feel nauseous initially when that happened, so they gave me some anti-nausea medication. And after that happened, I really was in a lot of pain. And I was crying, and it was not good. I was not happy. I was probably 9-10 pain scale, the worst I've ever felt. And so they gave me Dilaudid for that. That really helped. And then a couple hours later, I was able to consume some more broth, some Jello, ice chips, sip on water. I still was in a lot of pain, but I decided I didn't want to stay the night at the hospital, and my nurse thought that I didn't need to stay the night at the hospital unless I really wanted to for pain management purposes, but I felt that since I had my medication at home already, I would be fine with that, and if I had an issue, I could come back. So around 8 p.m. they discharged me. We went to the pharmacy. We picked up anti-nausea pills, just in case. I have 7 of them, and I have not used any of them. And I'm very thankful for that. I'm glad that I haven't vomited. I've heard some people have vomited immediately after surgery, and I can't imagine how painful that would be. Something I figured out day 1 was I couldn't laugh. It was extremely painful. You don't think about how laughter is incorporated with your diaphragm and your abdomen muscles. I think about when I go to the gym and I did a bunch of crunches, and the next day I'm sore and I laugh and my abs hurt, but I didn't really think about it for surgery purposes. And that really hurt, and that's been kind of a challenge for me. That's been probably my most lingering pain, has been from laughter. And I'll explain later on why. But it just feels like your stitches are being pulled. Like internally, it is not fun at all. Don't laugh. If you can help it, don't laugh. I got books. I've been watching murder mysteries and forensic files, and I may as well be a crime investigator now, because I've seen probably 200 episodes of these things at this point. But yeah, so that was post-op, my history, and kind of day 1. So I hope that I can continue on and share a little bit more of my experience, and that I hope that you get your answers answered. If you have any questions, please feel free to let me know. I'd be happy to respond back. I do have an Instagram I was tracking my story on, and still am. And I was tracking it on Facebook, and something that really led me to do this was I had seen a lot of videos of people doing recovery of their Nissen. But again, everybody's story is varied. But I thought I could answer a couple things that people weren't very clear on when I was watching, or answering questions I had about the procedure. So anyways, I hope you follow along. Thanks.